Coming up, we'll be on location at Virginia Hair Transplant in Lansdowne, Virginia, discussing the NeoGraft procedure, a breakthrough in hair restoration, and how it can help you get your own hair back and look great with minimal scarring, minimal discomfort, and minimal downtime with one of this region's top cosmetic and hair restoration doctors, Dr. Craig Vigliante. Dr. Vigliante is a board-certified and fellowship-trained cosmetic facial surgeon who has specialized training in both cosmetic facial surgery with a focus on hair restoration. Dr. Vigliante is widely recognized as one of this region's top doctors. Welcome, Dr. Vigliante. It's a pleasure having you back on our program.
Thank you, Rocco. It's always a pleasure for me to be here.
We have a lot to talk about. We have a patient that's going to be joining us a bit later as well. But I wanted to begin, if I may, Dr. Vigliante, by having you tell us about the NeoGraft procedure, which is a significant breakthrough in hair restoration from what we've heard and found in our research. And we wanted you to please tell us what it is and how it works and how it helps us.
Well, Rocco, NeoGraft is it's kind of a game changer in hair restoration. The old types of techniques involved strip grafting, where doctors would go in to the back of someone's scalp and remove a portion of the scalp with the hair follicles, and then take that scalp and sew it back together with either sutures or staples, and then spend time cutting up the hair follicles and then placing them back in the top of where the patient wanted it to be. This technique doesn't do any of that. It's a lot more minimally invasive, easy to recover from, minimal bleeding, and a lot less downtime. So it gets people back to work without any discomfort, basically.
And we understand that in addition to the NeoGraft procedure, which you're the only medical practice in all of Northern Virginia from our research who offers this breakthrough procedure, which is helping so many people in this region, that there is another option that a lot of people are aware of and are utilizing, but the NeoGraft procedure, from what we found, certainly has far more advantages. And the other procedure I'm talking about is the ARTIS robot option, I believe. Please.
Yes, the ARTIS robot is fairly new. Basically, it's a computer that a patient sits in front of, and the robot removes hair follicles individually. The big difference is that it's a human being has to remove the follicles as opposed to the NeoGraft removing the follicles for the patient. The problem with that, it takes longer, and also there could be damage to the follicle root as well, and that could affect hair restoration. In addition, it does take a lot longer than the NeoGraft procedure. Both of those procedures are considered minimally invasive. However, I believe the NeoGraft is a better procedure for the reasons I just mentioned.
And are there any other advantages that the NeoGraft procedure provides compared to the more traditional hair restoration options? Because not too long ago, but a few years back, we were all unfortunately accustomed to seeing men and women walking around with the cornrow hair plugs back then. I mean, those were hideous to see, but hey, it was some hair that we had on our head. But I understand things have advanced so far now, especially with the NeoGraft procedure, that you're looking at a world full of advantages now that weren't the case before.
Yeah, I mean, years ago, you would see a person across the room and realize that they had a hair transplant done. Those were called punch grafts. The mainstream way to do hair transplants today is with follicular unit grafting. And the way we do that is with single units, 2 units, 3 units, or 4 unit grafts to rebuild a hairline. And the way this works, and it can be done in multiple different ways. It can be done with the NeoGraft, which I have preference for, or it can be done with the ARTIS machine, which you mentioned, and it could also be done with strip grafting. So those are really the 3 main ways to do hair transplantation: strip grafting, NeoGraft, or the ARTIS grafting. But what we do is we take the hair and we transplant it as single units, 2 units, 3 units, or 4 units, with the single units being placed at the patient's hairline. Now, if you look at your own hairline, mostly they're single unit grafts. and that's how we restore it. And that's why today hair transplantation looks very natural as opposed to back in the 80s.
One of the options you mentioned, in addition to the NeoGraft procedure, the artist robot, was the strip method that you mentioned.
Yes.
I understand there's some disadvantages, though, from what we found in our research with that method. Can you please educate us a little bit more on that?
Sure. I mean, the strip method is more of a, quote unquote, a real surgical procedure because you're making incisions, which whenever you make incisions, it results in linear scarring. So one of the big disadvantages of it, patients that want to wear their hair short, you will see a linear scar with that technique. I mean, 100% of the time. And patients do not like that. It makes them very self-conscious. Another disadvantage is the bleeding that occurs. So there's more bleeding with strip methods, and that bleeding has to be controlled, of course. And then, in addition, there is more risk of nerve damage to the posterior scalp with strip methods. So the NeoGraft is a huge advantage, and it's part of this follicular unit extraction technique, which is not new to NeoGraft per se. I mean, it used to be done individually with individual skin punches to remove hair follicles from the back. However, it took a very, very long time, and it was very labor intensive. The NeoGraft is automated. So basically, it's an automated follicular unit extraction technique that allows us to remove the hair follicles without any linear scars in a minimally invasive way with minimal bleeding and a much decreased risk of nerve damage.
And not to mention minimal downtime, if any, as well.
Yeah, I mean, patients usually go back to work the next day or within 48 hours.
Are there any non-surgical hair loss options that are out there? Because we hear about, you know, Propecia and some of the others. Can you please tell us a little bit about that?
I mean, the two main ones over the years were really Propecia and Rogaine. Rogaine comes in a 2% solution and a 5% solution. Most patients try the 5% solution unless they cannot tolerate it for some reason due to scalp irritation or something like that. Both options have been very good for males. Females have not been able to use Propecia, especially if they're in childbearing age. However, there have been some studies recently that Propecia has helped females grow some hair as well. But historically, males would use Propecia or Rogaine, and females would basically use Rogaine to prevent hair loss. Now, it doesn't grow new hair, those treatments,
Yes.
but it prevents what you have from disappearing.
Yes, and certainly good options because of that benefit.
Yes.
It'll keep what we have.
It keeps what you have.
Yes. Now, who would you say, Dr. Vigliante, is a good candidate for the NeoGraft procedure? Who could really benefit from this?
Well, I'd say most people can, as long as they have good donor hair. We're genetically programmed. When we're born, we have all the hair follicles we're ever going to have. However, what's very important to know is that the hair on the sides of our heads and in the back especially are genetically programmed never to fall out. Such as in your case, you still have hair on the side and in the back, very small amount. But in your case, you would not be a great candidate for NeoGraft because you have very limited hair to transfer. Patients that have very good donor hair are good candidates to transfer. So there's only a limited amount you could transfer. But patients that have very thick curly hair, they're probably the best candidate. The second best candidates would be thick, dark, straight hair to transplant. I mean, because they tend to transplant very well and it covers the scalp very well. And a lot of those patients could get away with one hair transplant. Patients that have lighter hair, such as white hair or blonde hair, may need multiple transplants basically to cover and give them density, because lighter hair doesn't cover as well as dark hair, but it can be done. They just might need multiple procedures. So instead of someone gets one treatment or two treatments with darker hair, a patient with lighter hair or blonde hair or even white hair, they may take 3 or 4 treatments to get the job done.
Is the NeoGraft procedure for both men and women?
Well, it is, yeah. And actually, hair transplants in general, people don't realize that, but hair transplants in general are good for males and females. And this technique is basically a unisex technique. I mean, you can use it on anybody, and you can take hair. Another big advantage of it, actually, we didn't touch on it, but you could take hair from anywhere from that genetically pre-programmed area not to fall out. So, for example, it's kind of an anywhere method to take hair from. Sides of the head, back of the head. If you're doing a strip technique, you're kind of limited because how many strips are you going to take from someone's head? The NeoGraft, you can move all over the scalp, basically, to remove hair and transplant it.
I wanted to ask you, Dr. Vigliante, what is the difference between male and female hair loss?
Well, the main difference is the patterns are different. Males lose hair basically from the front to the back, primarily, and females lose hair from the middle of their head. So the main difference is the male loses his hairline over time, and the female usually maintains the hairline, but they lose it from the middle outward. And we just took care of a really nice lady this week, and hers was basically a stress-induced loss of hair, but she was the classic pattern where she lost her hair from the middle outwards.
What are good indications for hair restoration?
That's a great question, Rocco, because there are multiple indications. So people typically think hair restoration is just for the top of our heads, but in reality, we could use it for eyebrow restoration, eyelash restoration, and actually we could camouflage scars from previous surgical procedures or even cosmetic surgical procedures such as facelifts and previous strip method of hair restoration and things like that.
I think that's very interesting because I don't think most people out there, I certainly didn't until you just said it, realized that hair restoration isn't just for the top of our head or the back or the sides. Eyebrows, eyelashes, scarring from cosmetic treatments or procedures from years back. That's certainly good to know, Dr. Vigliante.
It is. There are multiple indications for it, and the NeoGraft is a perfect procedure for that because you're removing each hair individually, and it can be placed in eyelashes or eyebrows. You know, women typically are using marking pencils to give themselves eyebrows, and really they don't have to do that anymore.
Now, how many treatments are necessary, would you say, for the average patient? And I'm sure that depends on each particular patient and his or her needs, but in general.
In general, I'd say it's one or two, depending on what the patient's goals are. I think the biggest thing is what the patient's goal is. So we always ask the patient, what are your goals? Some people come in and they want us to restore their full head of hair. Some just want a hairline touched up a bit, like our patient today. He wanted more of a touched up hairline. It depends on the goals. Basically, if a patient just needs a touch up of a hairline, that's basically one treatment and you're done. If a patient wants to restore most of their hair, it's going to take a couple treatments to do that, usually 2 sessions. And the sessions take anywhere from 3 to 7 hours to do, depending on how much hair needs to be transplanted. And so it could be a half-day event, it could be a full-day event. Patients that have darker hair take less sessions usually. As we discussed earlier, patients with lighter hair may be an extra session.
And how many grafts would you say typically are needed per session? And again, I'm sure that depends on each patient and how much they're having done, but generally.
It depends on each patient. I mean, we could do as little as 300 grafts. We could do as many as 2,500 grafts. Patients that are losing most of their hair on the top of their head, they're going to need around 1,500 to 2,000 grafts in general. 2,500 grafts is pretty much the limit for NeoGraft because it would take too long. We'd be here probably all night.
Yes.
So we could transplant roughly about 2,500 grafts within about 8 hours, like a full day's work. If someone needed, for example, 300 to 500 grafts, that's more of like a 3 or 4 hour type of session.
What is the process that a patient would experience and go through from when they contact you and right through the whole thing?
Well, when patients come and contact us, we don't charge basically for consultation, so it's a complimentary consultation. We want them to feel comfortable with their surgeon, the staff, the whole team. We set them up a preoperative visit to answer any last-minute questions, give them their prescriptions, things like that. Once they decide they want to move forward, then what we do is we schedule them a surgical appointment when they're ready to do it, and we have a full team of hair transplant technicians that work with me to do the procedure, and they're very well educated. And then they come in for the procedure. They do the procedure, which is usually a half-day procedure or a full-day procedure. Then they go home. We see them about 48 hours later just to remove the bandages, make sure things are okay. And then basically they're on their way, and we let the hair just grow for a few months, and then we see them again.
That is such a simple and straightforward process, Dr. Vigliante, what you just told us about, that a patient experiences from contact right on through till everything's done and we have our hair back, as opposed to the more drawn out, more detailed, time intensive processes that took place a few years back.
Well, it's true, and I know sometimes it sounds too good to be true, but we see it day in and day out that the patients come back 48 hours later, they have no discomfort. We take the bandages off. There's basically no staples to remove. There's no sutures to take out. I mean, it's a totally different way to do a hair transplantation, and it is the best way to do it.
Yes, indeed. And I understand it's done right here at your office, at your practice, as opposed to a hospital.
True, yeah, everything's done in the office. Patients have a couple different options. They could do it under local anesthesia if they want to stay awake for the procedure, or they could be sedated for the procedure. We did a patient a couple of weeks ago that didn't want to see anything or know anything, so we sedated the patient all day, basically. But that's usually not the case. We did a couple patients this week. They both did it awake with local anesthesia. One was a male, one was a female. So there's multiple options anesthesia-wise. You could do it either way. But it really is, I've seen no difference really, except the fact that the patient doesn't want to know what's going on. I mean, there's really no difference in the technique. I mean, it's the same technique. It's just that some patients want to be asleep, some patients want to be awake.
Yes, and what kind of results can we expect from the NeoGraft procedure?
The results are fantastic. Very natural looking results, as opposed to the old days of hair restoration. When you're walking down the street after this NeoGraft procedure, no one will ever know that you had a hair transplant performed.
My goodness, that's most impressive indeed, Dr. Vigliante.
Yes, it is.
How far things have come.
Yes, it's come a long way.
We're now going to meet Ryan, who's a patient of Dr. Vigliante and Virginia Hair Transplant. Welcome, Ryan. It's a pleasure having you on our program.
Pleasure to be here. Thank you.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Ryan, by having you please tell us when you first noticed your hair loss and why you decided to take the next step to do something about it.
Well, I know hair loss is a natural, inevitable part of life, but I felt that with the technology today and the means available to actually do something about that it would be worthwhile to take a stab at it and try to improve my appearance and my confidence, actually. So I went ahead with the procedure.
Well, you know, that actually leads me to my next question, and you just touched on it. A lot of people, the hair loss does affect the confidence, the self-esteem, and you just mentioned that you were feeling that as well.
Well, it's a funny thing. I mean, hair is these little follicles up on top of your head, but
Yes.
The effect they have on your self-esteem and confidence is so much greater than what it might otherwise seem to be. But yeah, I felt that, you know, if you look better, you feel better, you have more confidence in your work and everything you're doing. So
Yeah, you're right. It's a domino effect in all areas of our lives,
Absolutely.
Unfortunately. Can you please tell us about your experience with the NeoGraft procedure and how did you hear about Dr. Vigliante?
Well, Dr. V's in the community, and I knew of him and of this newer procedure, at least the one he was going to be taking on, and it just seemed to be a perfect fit. The doctor comes across very knowledgeable and with a great amount of professionalism and expertise, and it was really a no-brainer for me to go work with him on the process.
Can you tell a little bit about what took place to zero in on the NeoGraft procedure as the option that you felt was best for you?
Absolutely. The doctor explained historically the process of hair transplants and how it's evolved over time, and leading up to the NeoGraft procedure. It just seemed miles ahead of other processes that were available and still available. Just a very less intrusive process, one with less pain, frankly, less complications in the overall process.
Yeah.
It just seemed very straightforward and something that would be fairly easy to get through with good results.
Yes, indeed. And I take it, looking at you, Ryan, that you've had that already.
Thank you.
Yeah, I mean, you look great. It looks so natural. You don't even look like you've had anything done, in other words, and that is a major advancement from what we perceived hair transplantation to be many years ago with the old cornrows. You remember all that many years ago, and now, my goodness, you look so natural, like you've never had anything done, like I said. And I take it you're very pleased with the results?
Absolutely, yeah. And everything's gone pretty much as the doctor had indicated it would, so we're kind of right on schedule, and you do have to be a bit patient with the process, but it's very effective. I'm very pleased.
Now, after you had the hair transplant procedure done through the NeoGraft procedure, I wanted to ask you if you experienced any discomfort or pain, Ryan, because, you know, a few years back, under the procedures that were available and popular at that time, people unfortunately used to experience, in many cases, a lot of pain after having a hair transplant. I just wanted to ask you what you felt.
I really had no pain whatsoever, and I was able to get back to work right away, so I really didn't miss a beat in my daily routine.
And how has it affected your life now that you have your hair back?
Obviously, I feel more confident in everything I'm doing when I leave the house in the morning and I look in the mirror knowing you know, how I look. It just gives you a little added energy and outlook towards facing the day, so very pleased.
Now, can you please tell all of us about your experience, not only with Dr. Vigliante, but the staff here as well?
Sure. The process is a surgery, but you know, with a great team that the doctor has, it was very comfortable and very smooth.
And lastly, Ryan, before I let you go, I wanted to ask you if you'd recommend Dr. Vigliante and Virginia hair transplant and the NeoGraft procedure to all the other folks out there that are experiencing hair loss.
Absolutely, without a doubt. It was a wonderful experience for me, and the results I'm very pleased with.
We're now back with Dr. Vigliante. Ryan's hair looks so natural. It's just what you said a few minutes earlier.
Yes,
Dr. Vigliante, most impressive results.
Yes, yes. Yeah, Ryan is an ideal candidate for hair restoration. He has great texture hair, he has curly hair, dark hair. So performing a hair restoration on him for us was a pleasure to do. Minimal discomfort. I rarely heard from Ryan after the procedure. He was very happy, and we always check on our patients afterwards, and he had no complaints.
Yes, indeed, and he told me a few minutes back that he started seeing hair growth within a few months, and then it just kept going right through the whole process to the point where he is now.
That's a good point, because hair restoration, when we transplant the hair, it doesn't grow right away. It takes time to root itself in the scalp, and then you start seeing hair growth after about 3 months, and it grows in through a full 12 months. So you really don't see a final result from hair restoration for about 12 months. So that's why it takes some patience to wait and see the result. But once you get the result, that hair is genetically programmed never to fall out. So once it's moved and placed in that new spot, it stays forever.
And he brought up a point that is really relevant to so many of us, and that who suffer from hair loss, Dr. Vigliante, and that is, it really does affect confidence to some extent. You just don't have that same zest sometimes that you may have when you suddenly, you know, have your head of hair again, or what you did when you were younger, for example.
Now,
He's right about that.
He's right. I mean, we all work in a very competitive environment in different fields of work, and at the workplace, it does give you a competitive advantage, I think, to have hair.
Yes. Yes. Are the results permanent from the NeoGraft procedure and other hair transplantation options?
Well, the great thing is it is permanent because each hair follicle is genetically programmed to stay in forever from where it's taken in the back of the head. So the beauty of it's permanent, and once a patient does it, they typically do not have to do it again once they get their hair where they want it.
Well, that's certainly a great benefit right there. We don't have to worry about losing it again.
No.
Now, how safe is the NeoGraft procedure, Dr. Vigliante?
The NeoGraft is really the safest procedure I've been involved in from the standpoint of minimal bleeding. I mean, it's amazing when you can do a procedure that takes half a day or all day to do, and the patient loses hardly any blood. So that's a big advantage. Minimal swelling also, and so in general it's very safe. And as I mentioned, it can be done with local anesthesia, just with the patient awake, or with sedation as well.
Yes, indeed, and especially on the safety issue, from what we found in our research, is it's by far the safest of the options with the best results, because some of the other options you are looking at more blood and more swelling, unfortunately, when it comes to other hair transplantation or restoration options.
Of course, and whenever you have a long procedure, which hair restoration typically is considered a longer procedure because it takes you at least, depending on how many grafts that you're doing for the patient, it could take 3 hours, it could take 7 hours. So when you're having a procedure that's that long, you want to limit the blood loss,
Yes.
and this procedure does that.
Now, we're literally out of time, Dr. Vigliante, but I wanted to ask you before I let you go, you and your practice, Virginia Hair Transplant, here in Lansdowne, Virginia, have certainly established a reputation for excellence in hair restoration and patient care. And I just wanted to ask you what you feel helps separate you and your practice apart from the others.
Yeah, I think what separates us first and foremost is that we are a cutting edge practice. I mean, we have the latest technologies, we keep up with the latest technologies, as has proven with the NeoGraft. I'm excited to have teamed up with NeoGraft and invested in that technology to deliver this type of treatment. Because I'm a big fan of doing minimally invasive surgery and getting big results, and the NeoGraft allows me to do that. And it's been a great addition to our armamentarium of cosmetic facial procedures that we offer here at the practice.
Yes, indeed. It's a breakthrough, the NeoGraft procedure is. And
It really is.
I really want to thank you, Dr. Vigliante, for educating us about the benefits of the NeoGraft procedure and how it can help so many of us, and also for being a guest in our program. It was our pleasure having you on today.
Oh, thank you so much, Rocco. It was a pleasure for me to be here.